We are going to talk about thermal agents, specifically cryotherapy and thermotherapy in chapter 7 and chapter 8. And we're going to spend about half a day in lab just learning about just the application of heat and cold agents. As you know, most heat and cold agents like hot packs and cold packs are not billable charge codes. We are often going to be educating patients on how and when and why to use either heat or cold. So it's important to know that. And it's part of the body of knowledge to know some of the theory behind thermal agents. So I'm going to briefly talk about some terminology and theory and different types of thermal agents. And then we're going to talk a little bit about cold, a little bit about heat. There are two PhysioU simulation modules that you can do before or after the second lab, or before and after. You can do them as many times as you want. And those PhysioU modules are just nice for bringing all the information together. So, and they're worth a few points. We love that, right? So the learning objectives for this chapter are to define specific heat and its application to the use of thermal agents, define and provide examples of conduction, convection, conversion, radiation, evaporation as modes of heat transfer. So thermal agents, it's all about transferring heat from one thing to another. So transferring heat from something to your body or from your body to something else. So moving heat back and forth. We want to be able to identify and describe the components of the rate of heat conduction. So so the faster you try to conduct heat to something, the closer you are going to be to a burn. So we want to control the rate of heat conduction, and by knowing the components of it, we're going to be able to do that. We want to be able to define thermal conductivity and provide examples of high, moderate, and low thermal conductors. I bet we could all think of some right now. And we want to state the significance of specific heat and thermal conductivity in a therapeutic environment. So modes of heat transfer, conduction, convection, conversion, radiation, and evaporation. And we're going to talk about each of these. Conduction is exchanging energy between two surfaces by direct collision of the molecules of two materials at different temperatures. So that's like putting an ice pack on your arm, and the heat goes from your arm to melt the ice pack, basically. Conduction requires direct contact of the targeted area with the heating and cooling agent. So it has to be touching you for conduction. Heat's conducted from the material at the higher temperature to the material at the lower temperature. So like a hot pack or warm paraffin, the heat goes from the heating agent to the patient. An ice pack, the heat goes from the patient to the heating agent. So hopefully that makes sense. Specific heat and thermal conductivity are big players in thermal agents. Specific heat is the amount of energy that is required to raise the temperature of a given weight of material by a given number of degrees. And usually it's specified it's 1 cubic centimeter of material by 1 degree Celsius. Materials with higher specific heat, we're not going to calculate or anything, so don't worry. But materials with higher specific heat require more energy to heat up, and they hold more energy at a given temperature. So something that holds more energy, like the difference between just ice for a cold pack or those gel cold packs that have the clay on the inside. The clay holds more energy at a given temperature, and so it's going to be more effective, or it's going to last longer. That's what it's going to hold more energy at a given temperature. So thermal conductivity, we'll talk more about that. Thermal conductivity is the rate at which the material transfers heat by conduction. So how fast does it transfer the heat by conduction? And it depends on the temperature difference between the materials, their thermal conductivity, and the area of contact. So metal has a higher thermal conductivity than bone, muscle, or fat. That makes sense, right? If you put hot metal on you, that's fast rate of transfer. Water has a higher thermal conductivity than air. So you're going to warm up faster in warm water than you do in warm air. So hopefully that makes sense. So specific heat of various materials. The heat of different materials and body tissues, the specific heat differs. So skin has a higher specific heat than fat or bone, meaning skin heats up faster and holds the heat longer than fat or bone. Water has a higher specific heat. I mean, it takes more energy to heat it up. Sorry. And water has a higher specific heat than air. So water holds the heat better than air does. Hopefully that makes sense. So materials with a high specific heat require more energy to heat up and hold more energy at a given temperature. So when transferring heat to a patient, thermal agents with high specific heat like water are applied at a lower temperature than thermal agents with a lower specific heat like air. We're not usually heating people up with air, but I guess if you think of like a sauna, where like you're heating up with hot air, it's going to take longer um and higher temperature than heating someone up with water, putting them in a warm pool. So hopefully that makes sense. And so the whole idea is, how are we transferring heat from one thing to another? And usually one of those things is a human body. In physical therapy, it always is. So for safe and effective heat transfer, we don't want to transfer it too fast. We don't want to transfer it too high a temperature, and we want to have insulating materials. So we need the materials that with high specific heat and moderate thermal conductivity are best for transferring heat to a human. There needs to be well-tolerated initial differences in temperature, meaning if you have a super hot pack and you're cold, it's going to transfer the heat too fast. We don't want to do that. So one of the reasons we always want to document the initial heat of the hot pack from the hydroculator is to make sure that we don't have too much initial difference between the human body and the hot pack to protect the person. Insulators like towels are great insulators. They hold air and they limit the rate of heat transfer. So nubbly towels like that, the towels have little nubbins on them, and in between the little nubbins are little pockets of air, and those little pockets of air, which have lower thermal conductivity, limit the rate of heat transfer. So towels are great insulators. You want to remove metal jewelry from any area that'll be in contact with a thermal conductive agent to avoid excessive local heat transfer. So if someone's wearing a necklace or a ring or a toe ring or whatever, take it off while you're putting the heat on there. So the rate of heat transfer is the area of contact times the thermal conductivity times the temperature difference between the two surfaces divided by the tissue thickness. We're not going to calculate that. It's just giving you an idea. So the greater the temperature difference between the thermal agent and the body part, the faster the rate of transfer is going to be. So materials with high thermal conductivity transfer heat faster than materials with low thermal conductivity. The larger the area of contact, the greater the total heat transfer. So if you're putting an ice pack on the back of somebody's hand, I'll just say for an example, that's a pretty small area of contact. There's some heat that's going to go from the hand to the ice pack, but not as much as if you put an ice pack on somebody's low back. There's a greater area of contact, so more of your heat is going to go into the ice pack. The rate of temperature rise is proportional to the tissue thickness. The deeper the tissue, the less its temperature will change. So hopefully that makes sense, and we'll talk about depth of tissue with regard to some other modalities as well. Convection is heat transfer by direct contact with a circulating medium of another material of a different temperature. So that's like you get in a cold whirlpool and you're going to cool down a lot faster than if you just put your foot in a still pool of cold water. The circulation increases the rate of heat transfer. Convection transfers more heat than conduction. So you can do cold transferring heat from the body with a circulating medium, or you can do transferring heat from the medium to the body with a circulating medium. So examples of it are like whirlpools and fluidotherapy. And fluidotherapy, if you haven't seen it before, there are some photographs in the book, but your circulating medium is basically this almost like a grain. I think it's like cracked corn or so, or that's what it smells like when they heat it up. It circulates, and like you put your hand in there, hand or foot or whatever, and usually extremities, and it circulates that warm medium around you. I've worked with OTs that use it a lot for hand therapy. That's the mostly where I've seen it. Also, I've personally have used it for sensory stimulation and neurotherapy, just because more things are touching the area and stimulating sensory nerves. Circulating blood is an example of convection that helps maintain physiological temperatures. So kind of interesting, but it's not super common that we use that. But also think of it in terms of if you have someone in a it's like a hot tub with jets, it's going to heat them up faster than just a still pool. So think of it that way. Conversion is where you convert a non-thermal form of energy into heat. So like mechanical energy, electrical energy, or chemical energy. Ultrasound heats by converting mechanical vibration into heat. So it's actually a two-way conversion. It converts electricity into mechanical vibration, which vibrates the tissues and converts it into heat. So lots of conversion there. Diathermy heats by converting electromagnetic energy into heat. Our metabolism in our body heats by converting chemical energy into heat. So when our cells metabolize proteins, carbohydrates, and fats, they break down those chemical bonds and they form. So basically, they burn hydrocarbons in oxygen and create water and carbon dioxide and heat. So it's an exothermic reaction, and that's conversion. Unlike heating by conduction or convection, the temperature of the thermal agent is not important. So you're not getting heat from the ultrasound head or from the diathermy device. It doesn't require direct contact. And it may have other effects beyond just heating, and we will talk about the thermal and non-thermal effects of ultrasound and diathermy. Radiation is the direct transfer of energy without the need for an intervening medium or contact. And I like the image of like warming your hands by the fire. That is a classic form of radiation transfer of heat without direct contact. You don't put your hands in the fire. You stand back and you warm your hands at the fire, which that's a great example. Infrared lamps or the sun transfer heat by radiation. So obviously we're not touching the sun, but we can feel the heat of the sun, especially if you're at high altitude and the sun's just beating down on you because you're closer to it. So the rate of temperature change depends on the distance and angle of radiation to the treatment area. So that's why the sun's hotter when you're at high altitude because the distance is less. The intensity of the radiation and the relative sizes of the radiation source and the treatment area. So they used to use infrared lamps in therapy for treating all sorts of things and for heating. And now there are other treatments that's sort of gone out. Um, but the rate of temperature change is going to depend on that. So if you have a big bonfire, that's higher intensity radiation, you're going to get warm faster. Huge bonfire and you're just a small person, relative sizes of the radiation source in the treatment area, and the distance and the angle. So if you're really close and you're holding your hands out, you're going to feel it. If you're a little farther away, it's going to take longer. Makes sense, right? So evaporation is where energy is absorbed to change a liquid into a gas or vapor. And that's how our body normally cools itself. Um, Evaporation of sweat from our skin to cool ourselves down. The material that contributes energy for evaporating a liquid is cooled in the process. So, in therapy, a vapor-coolant spray is sometimes used to for evaporation to cool things down. Sweat on the skin, like I said earlier, cools the skin that heated it, and it's turned into vapor. Ambient humidity impairs evaporation, so that's why it feels hotter when you're in Virginia or some other humid area. Ambient humidity impairs your evaporation, so your sweat mechanism doesn't work as well.